Mine is very simple. Thankfully, we've been discussing a lot of your experiences. And a lot of you have been working on, using implementation science in what you're already doing in the different countries. For some of you, it will be sort of new conversation, just in the terms of framing, but not nothing very, very much rocket science. So no worries, it's not heavy theory. So my presentation will build on the guidance document that was launched yesterday, which you all have a copy of. And again, as the moderator says, we are all available to answer any other questions that you may have. I'm supposed to be discussing bridging theory and practice with implementation science. Like I said, we already have a lot of this from your presentations. There you go, thank you. So I think we're all in agreement that there is evidence that MMS works. We have global evidence, countries already implementing this with lots of success stories. Ramadan just shared the Ethiopia example, which is a great success story, and other countries as well. But we are all aware, we're all coming from that background where we agree that the delivery platform that we've had for IFA did not necessarily, or has not necessarily helped us achieve the outcomes that we intended. We've had issues, as we've had over the past 1.5 days now, we've had issues related to ANC attendance, for example, mothers coming in late, or not coming as regularly as we want them to come. And sometimes we give them the IFA, they don't use it, or they don't just take it at all in the first place. Then there's been discussions around supply chain, which again, Ramadan and others have just alluded to. And then we have issues to do with some bottlenecks around policies which make it difficult for countries to scale up if they've introduced this already, or even to initiate that whole conversation around MMS. So we just in thinking about that delivery platform, I think we are in agreement again that we are working to strengthen the whole ANC platform, not just for MMS, but for the whole range of services that pregnant mothers receive. So hence the need for stronger MMS delivery platforms. And why we need this, we are saying we need this strengthened platforms because they will help us, first of all, to improve access. To improve access, talking about demand generation here, we want to bring in the mothers, we want to bring them in earlier on in the process. And this is where all these SBC strategies we are talking about come from. We also want to make sure that once they come, they can get all the product that they need when they need it. So enhanced efficiency in the whole delivery process. So address all the bottlenecks in advance, or at least address as we go on. We are building the system. We are flying a plane as we build it, as we say, and ensure that it's also scalable. What we are doing is scalable and sustainable. I know that whole discussion around sustainability has been key during this meeting. And lastly, our goal is to ensure better health outcomes. That's increasing MMS coverage, ensure more women have access to it. Once we finish our initial researches and demonstration projects and all, so just scale it up. But then there are questions around how do we scale up? We've had donors here already offering, to support that process. But we need to think about that, begin with the end in mind as we start. So hence implementation science. And like I said, we've had this word a lot. People talked about it yesterday when launching the guidance. And so I just wanted to give an overview of how we are using, or how you could use IS to support the introduction of MMS and scale up of MMS in your countries. But also just bear in mind, like one of our colleagues, I think it was Saskia or someone who said, you could actually use IS for literally anything else. It just provides you with a very systematic approach to design, to implement, and to evaluate interventions and programs within your context, and to make sure that these programs are actually both effective and sustainable. And I think, again, just underlining that effectiveness and sustainability. How does IS do this? So here we highlight 4 key ways in which implementation science helps us to do that. And the first one is by providing us tools, evidence-based tools. So there are tools that exist already. I know Healthy Mothers, Healthy Babies, and a lot of the partners in this room already have that kind of, they have those resources which everyone is willing to share. So there is a huge database of tools that you could use. Tools, for example, to conduct landscape analysis, tools to conduct stakeholder mapping and stakeholder analysis, formative research, everything that you need to ensure that you collect that contextually relevant information that will help you design strategies that work for your setting, and then go on to implement them and scale up. AIS also allows us to do continuous and systematic monitoring and adaptation. I like what Ramadan said when he was just here, that they're doing they're still testing. They have strategies that work, but they're still testing them. They're still refining them, trying out other models which work for their context. And I think that's the whole premise of the WHO's guidance, to make sure, or to encouraging us to introduce MMS within the context of rigorous research. And rigorous research is defined in some of these ways. We provide contextually relevant information that we can actually use to design things, strategies that work for our settings. But underlying all of this is stakeholder engagement. Again, everybody has talked about stakeholder engagement, and I know there are many questions here. People have asked, why don't we have such and such categories of people in the room? But I hope that this is a rallying call for all of us, that when we go back, we should be thinking about who else needs to be part of this discussion, and at what point do we bring them in? And I think the agreement is that the earlier, the better. The earlier you have everyone, all the stakeholders that you need in that room, discussing the different parts of this, this process. We have, for example, you will need people who actually fund. Most of the national stakeholders that will be in this room are not ministries of finance, for example. But you do need to hear from that. You do need to hear, for example, in Kenya, you do need to hear from, the Kenya Medical Supplies Agency. You need all those people in the room from the beginning and all the way through. So you're not just consulting them at the start, but you're consulting them and carrying them all the way through to ensure that what you're doing is, one, there's local ownership, but also that it's sustainable, that you're thinking about that sustainability at the beginning, not towards the end. And again, IS ensures that what we are doing, and I think I already mentioned it, that it's very, very contextually relevant. While we agree that global evidence is there on effectiveness, we're not trying to test effectiveness. Again, we're not trying to conduct clinical research, but we can find out what strategies work. And we find out from our communities, we find out from the beneficiary communities. Laura and I, some from UNICEF, were talking earlier on about how the information that mothers hold, these end users, sometimes we may sit here and design things that we think work for them, but actually the final solution, what actually will make her take the MMS, is such a simple solution. It's not just that we brought it there, it's just that we've listened to her. In some countries, I think it was Mali, where they say, don't call it medicine, because when you call it medicine, it creates some connotations of that I am sick. Let's change that, just a simple thing like that, just changing the naming at the local community. It improves coverage in ways that we have not, we had not thought about. So in the guidance document, we have been provided with a framework to support national MMS introduction and scale-up. There are several levers, several pillars that we're trying to influence. We're trying to influence policy and the regulatory space. We're trying to ensure that MMS is included in national EMLs. We're trying to ensure that at least the supply chain thinks and the logistics team thinks about MMS. We're also thinking about financing. Where are we getting the money to scale up? I know there was a question from the lady from World Vision that, we want countries to also co-own this process. We want to ensure that there is not dependency. And so we have to get people thinking about this from the onset. Not, you can get all the donated product for research, but when it comes to national scale-up, we have to think about where, whether it's domestic financing, where that money is coming from, and then the match funding along the way, as others have said. And then the quality of the product and delivery channels. So this guidance document, it guides countries through the introduction and scale-up. It's targeted at national stakeholders, but literally everyone can use it, implementing partners. But I'm not saying we use it independently. We use it to support governments to do that. It's in a phased approach. There are 3 phases which we'll talk about, and those 3 phases are, that's what Martin and team used to categorize countries in the way we saw yesterday. And it's also tailored to context, and that means that you can adapt it to your national realities. You can take it, again, I said, you can adapt it to national realities for MMS, you can adapt it for national realities for any other intervention in this space. And then it also encourages stakeholder engagement. We cannot sing enough about the importance of stakeholder engagement, because we know what is right for mothers, but there are some other people that are involved in the decision making who, if they're not in this room or if they're not part of the process, will actually be the bottlenecks, not the mothers. The mothers may want the product, but there are other people that may actually block that process. So we need to collaborate from the onset. And then it also thinks about the age. There is emphasis on ongoing monitoring and evaluation. Adapt to your local situation. Keep reviewing, keep monitoring to see whether what the strategies that you designed are actually leading to the intended outcome, and if not, make changes. So very quickly, those 3 steps. The first one is building an enabling environment, which I think most of the countries here will have gone through or are still in that phase. And here it's just the situation analysis, trying to understand where we are as a country and our own readiness, the country readiness for even initiating the discussion on MMS, or if you're initiating that discussion on MMS, this is the stage at which you collect data from desk reviews, landscape analysis, to understand the policies, the opportunities that already exist. Remember, we're not trying to create a parallel system. We're not starting something from scratch. Something already exists, which is what we're trying to build on. So work with stakeholders, collaborate, engage with the global evidence at that point, engage with local evidence as well. We know that there is local evidence about some things. In Kenya, for example, we've done an IFAS assessment not too long ago, so we have some evidence. We have somewhere to start from. But then building on that, then identify the questions that are still remaining. What don't we know? So while we're saying we have coverage of 80% of something, why is anemia prevalence still so high? What's the issue with adherence? If we have counseling documents that we're using with mothers, what is it that we're not doing? What is it that is making mothers not take these supplements? Or where do we have barriers? Is it barriers from the provider side? Is it, just the whole ecosystem of delivery? And then we start addressing these questions through situation analysis again or formative research. Yeah, so we address this. In some places, it's been through the situation analysis. In other countries, formative research. And I've had the conversations here with many other people who, through formative research, have actually been able to identify strategies that work for their setting. And then once you've done that, through that, just to go back a little bit, when you're building this enabling environment, you're trying to ask questions like, what are those existing delivery platforms in your setting, including the policies that back them up? And therefore, what are the gaps? You're also trying to find out what are the barriers and enablers to MMS introduction, at least working off what you already know, which is IFA, which we've all used IFA. So what has worked for IFA? What has not worked for IFA? And how can we address that? And so we come up with questions. And again, this is a collaborative effort. So we're not just leaving it to the Ministry of, the Department of Nutrition to do this. We are working with everyone else who needs to be involved in this conversation to try and design or come up with questions that can be answered, that we can answer in a way that will help us generate contextually relevant strategies or solutions. And then in the next phase, and the design and test implementation strategies phase, where some countries are, this is where Uganda and others are. Ethiopia has already passed this. So in this stage, you co-design. So this is the beauty of implementation science here. So when we talk about stakeholder engagement and collaborative efforts, we are co-designing strategies with beneficiary communities, with healthcare workers, with policymakers. So everyone's voice is heard. So we give a voice to everyone to be involved in this conversation, because at the end of the day, we need ownership. At the end of the day, we need mothers to understand why we are saying you really need to take this consistently and what it does for them. And that, if they come up with a strategy, in some places they'll say the reason why I don't adhere to it, I simply forget. I just simply forget. So let's involve my partner. Someone talked about male engagement. Let's involve my mother-in-law so people can remind me. So you have the mother has a whole support system in the community, because you're not just leaving the conversation to the end user. We are involving everyone else to come up with strategies that work for this mother. We are all interested in this mother, but we need to support her. So we design strategies, and then we implement. So we implement MMS, we implement the strategies and test those strategies. So those some countries are at that level now. And when you're testing this, you're really trying to test for, some of the questions you're asking is about the acceptability of that strategy, acceptability of MMS itself. You also want to know the appropriateness or the feasibility of integrating MMS within this ANC delivery platform. Remember, we said we're trying to strengthen the delivery platform, and MMS gives us an opportunity to do that now. You also want to know the impact of the strategies, but also the unintended consequences of those strategies, because then that gives you an opportunity to change course, course correct at some point. And finally, to check the fidelity of your implementation strategy. And there are many other things that you could test for. But the focus here should just be on the process, the implementation outcomes and process outcomes. Like I said earlier on, we are not trying to check for clinical effectiveness. That evidence is already there. And then finally, scaling and maintenance. So now you have your evidence that this strategy works, and some people already have evidence that strategies work, and you are at the point that now you're thinking about scaling up. Again, go back, make sure that everybody has been part of this process, including the people that need to fund it. That's advocacy is an ongoing discussion here. So you scale up the intervention, and while you're scaling up, you're also monitoring, you're adapting as needed, and conducting research on the side to assess the impact of your implementation. So as in this summary slide, I just wanted to say that IS tools, there are tools and methods that can guide that entry, that introduction or scaling up within MMS delivery platforms, in this case, antenatal care platforms. There are methods like the literature reviews, landscape analysis, situation analysis, that can help you understand the context, the local context. There are methods to help you address barriers and engage communities, such as the bottleneck analysis, the formative research, that help you design or come up with strategies that work for your context. And then finally, to ensure continuous improvement, there are methods that you could use. And again, the tools are there. People are happy to share. There are methods on process and impact evaluation, economic assessments, readiness assessments. And all of this, we are all here to support the process. And I'm sure HMHB and everybody else is happy to share every other document that we have to help you with this process. So happy to answer questions later on, or get Philomena and Martin and others to answer those questions.